In the week prior to our inaugural medical optometry mission in Grenada, we advertised the mission on a local radio station.
If life is becoming a blur, get your eyes checked for free. Seriously. If you have glaucoma or are experiencing itchy or dry eyes or have an eye infection or you need reading or sunglasses, then you should take advantage of
And I did TV interviews and other groundwork to prepare us for the work ahead.
But the mission is strictly eye care. So we're going to be testing individuals, patients, making sure that we look for the diseases of the eyes, we're looking for glaucoma, cataracts, etc.
But nothing could have prepared us for what we encountered on the opening day of the clinic. The crowds gathered at 3 a.m. All 6 parishes were represented, including some families who traveled by ferry from the sister island of Carriacou, approximately 16 nautical miles and 1.5 hours away. We were a diverse team of 21 volunteers representing the United States, Grenada, and expats from both Grenada and Jamaica. Our motto was Eyes on Grenada. As we approached the clinic from the main road, we stared in disbelief. The parking lot was abuzz with scores of anxious people attempting to gain entrance into the youth center, our makeshift clinic for the next 4 days. It was 8:30 a.m. when we arrived, and the clinic was scheduled to begin at 9 a.m. What we witnessed as we hurried to the entrance of the building can only be described as shock and awe, as the crowd pushed their way to the entrance in order to secure a seat and ensure they would be attended to. Inside the spacious arena-style building, the seats on both sides were filled to capacity, and the open plain area between them was also filled with people standing, jostling, and shouting at each other, and the few unarmed security guards who were desperately trying to maintain order. The noise and shouting were due to the fact that there was no seat in order, and those who came early were trying desperately to make sure that later arrivals were not seen before them. We estimate that there were over 1,000 people gathered on the premises. We had estimated seeing about 200 patients per day. This was the scene that greeted us on March 25, 2024, day 1 of our Grenada medical optometry mission. More than 2 years earlier, I had approached Joan Crawford, president of the Alliance of Jamaican and American Humanitarians, AOJA, about doing a medical mission in Grenada. She immediately agreed, and I set about trying to get the mission off the ground. My first task was to meet in person with officials in Grenada's Ministry of Health to apprise them of our plan and understand the country's priorities in terms of health. They identified eye care as one of their top priorities, and with that, I began to work closely with the AOJA team to make the mission a reality. AOJA is a US-based non-profit organization that has been conducting large medical missions in Jamaica for over 10 years. Additionally, they are actively engaged in sponsoring programs for the disadvantaged, such as feeding the homeless in Los Angeles and sponsoring scholarship programs in Jamaica. Their reputation is what attracted me to approach and partner with them for the Grenada mission. The first order of business as we entered the clinic area on Monday was to manage the crowd. There was no way we could begin work amid the noise and confusion. Fortunately, Joan Crawford took the stage and with bullhorn in hand explained that unfortunately we would not be able to see everyone. She pleaded and cajoled the crowd. She even threatened that we would pack up and leave if they did not quiet down. All those standing were advised to leave. She announced that 800 tickets would then be distributed for Monday through Thursday. This caused additional commotion in the crowd, as everyone was now trying to make sure they received a ticket. The unfortunate ones who did not get a ticket would not be seen. It was a heartbreaking decision, but we had no other options. Many people who had gathered and waited in the early morning would be turned away. However, in spite of the disappointment and frustration, the crowd gradually thinned to a more manageable number, and by 9:30 a.m., we had begun to see our first patients. Our goal coming in was to give preferential treatment to patients who were observably either mentally or physically challenged. And in that regard, I think we succeeded. Although many who were turned away argued that they deserved preference because of the distance they traveled, their early arrival time, their inability to get time off from work, family and caretaker responsibilities, transportation challenges, and problems with their eyes that required critical attention. 3 policemen even insisted that a special day should have been set aside for policemen and certain government officials because they are public servants. I was quite happy to quash that suggestion. Listening to all those genuine and heartfelt pleadings, one could not help but feel compassion and empathy. Their stories were heartbreaking, and I heard more in one day than I'm prepared to recall. But it also stirred us to be more determined in our efforts to help as many as we could. A few suggested that we should have implemented a pre-registration process, but Aoja's past experience in Jamaica cautioned against it. Besides, pre-registration would normally be advantageous to those who are young and savvy with electronics, and otherwise have the means and contacts to take advantage of the system. It would also have introduced some level of chaos, as some ticket holders would invariably be late or missing when the number was called. Despite the late start and apparent initial chaos on Monday morning, we saw 259 patients, 59 more than we had projected. On Tuesday, we saw 291, Wednesday, 354, and Thursday, 318. Our 4-day total was an astonishing 1,222, 422 more than we had planned. As part of our clinical process, we registered each patient and performed various tests, including visual acuity, eye pressure, and autorefraction. Our doctors examined and diagnosed every patient and prescribed medications, reading and sunglasses, and walking canes as necessary. By midday on Tuesday, Dr. Maxwell Chang, our lead optometrist, informed us that we were running low on certain prescriptions and medications, including Timolol, used to treat glaucoma, a very prevalent disease in Grenada. The gains in efficiency day over day can be attributed to our morning scrum sessions, where we identified bottlenecks in the process and adjusted accordingly. More importantly, though, was the fact that our volunteers stepped up to meet the challenge, some foregoing lunch or shortening their breaks, filling in wherever a bottleneck was observed, and working dynamically and harmoniously to meet every new challenge. One very satisfying accomplishment for the team was setting aside time to see 33 kids who were afflicted with sickle cell anemia, a debilitating disease that normally affects the eyes in addition to other vital organs. One patient was actually experiencing a mild crisis while waiting to be seen. Others who were scheduled to be seen could not attend because some were in more severe crises. Setting aside time to see these kids was a very personal commitment for me. We also did the same for the Grenada National Council for the Disabled. The over 1,200 patients we saw represented a cross-section of Grenada. There were middle-aged and elderly patients, those who were legally blind, very young kids, young and middle-class working professionals, students, and those who were physically and mentally challenged.
Benefited from the free eye care services that were provided this week by the Alliance of Jamaican and American Humanitarians, a California-based humanitarian organization. The team conducted eye exams for conditions such as glaucoma and cataract, distributed glasses to those in need, and ensured that individuals diagnosed with glaucoma received a year's supply of necessary eye drops. The clinic, which was held at the Youth Center, commenced on Monday, March 25th and concluded on Thursday, March 28th. President of the Alliance, Joan Crawford, told the Government Information Service the numbers surpassed their expectations.
I can tell you this. I do mission to Jamaica, and I've been doing that for about 20 years, 12 years with our organization. But we do many different areas, surgery and what have you. This is an eye mission. One of the surprising things is that we had planned to see 200 people a day. We did not expect to come and see over 1,000 people the first day. So what we did was we were planning to see 200. So we gave out all the tickets. We had tickets for Monday, Tuesday, Wednesday, and Thursday.
Grenadian Roy Vincent is the mission's organizer. He said that it is his aim to get the Alliance to pay a yearly visit to Grenada.
My plan is working with AOSA. I'm now on the board of AOSA, so I can help influence that. Is to get us to come here once a year, probably step up what we're doing, bring in more doctors, not just eye care doctors, but internal medicine, physical therapy, that sort of thing. So bringing a variety of services. So stepping up what we do, and then go out to the parishes. So one of the problems is that we're just based here, so everybody came here. If we go out to the parishes, we have more manageable numbers on a daily basis.
What our 4-day clinic emphasized is that there is a dire need for more and better eye care in Grenada. It must be made more affordable and attainable for all, so that patients would not be forced to ration their medications. There should be more public education about protecting the eyes, especially for those who work outdoors. Everyone should be encouraged to visit eye care specialists and clinics regularly. The large number of people that showed up at the clinic suggests that there is an overwhelming need for eye care in the country, and eye care issues have a detrimental impact on the social and economic quality of life of those who are afflicted. This is also summarized in the numbers compiled by Dr. Cheng. It's not because the clinic was free, as some sarcastically suggested. Extrapolated to Grenada's population of 110,000, approximately 12,000 people are afflicted with glaucoma, and over 22,000, or 20% of the population, will require some sort of acute eye intervention. One would expect that most people would have been frustrated after waiting several hours to be seen, and some having to return a second day to be seen. However, this was just the opposite. Once the clinic operations began, most patients became more relaxed and thankful. Despite waiting several hours to be seen, some gladly offered to allow others who had physical or mental challenges to go ahead of them in the queue. Many would go out of their way to express their appreciation for our service and the desire that we would return soon.
Well, it's beneficial for a lot of people that cannot afford to get the glasses. Like, to get the glasses is really expensive. Like, for me, my glasses cost like about 6,000 going. Yeah, so it's really helpful for people that not really working or they cannot make up the money to afford one.
Oh, good morning, good afternoon. What's your name?
My name is Mona Joseph. I'm a Dominican living here.
And what do you think about this free eye clinic today?
It's very good because the amount of people that suffer in his eyes, that on me. I make operation in my right eye for cataract, and in the left, I see a little dim. So I hope I would be able to get help because it's not easy. Living in a foreign country, it's not easy. But otherwise, glad to have you all here.
Thank you.
Merci, Missy.
My name is George John.
And what do you think about this free clinic here today?
We are very happy to have you all here because there are lots of Grenadians who have problems with the sight. As you see, the large turnout. And I guess as much while you all are here, we very appreciate you all here.
We ended our successful clinic with an appreciation event for our volunteers. I invited the Prime Minister of Grenada, the Honorable Dickon Mitchell, to join us to help recognize and thank the volunteers whose dedication, commitment, and sacrifice helped make the mission a resounding success. It was a fitting end to have the people's ultimate representative acknowledge the contributions of the volunteers, and a capstone event marking Aoja's introduction into missionary healthcare work in Grenada.
I'm Maxwell Cheng, the optometrist who helped lead the medical mission to Grenada in March 2024. More than 1 billion people around the world have a vision impairment that has not yet been addressed. It's been shown that when prioritized, eye health can yield $36 in benefits for every $1 spent. So for every dollar spent on glasses or cataract surgery, this can produce $36 in benefits, more than any other development intervention. In Grenada, people not only need glasses but also need eye exams to diagnose and treat glaucoma because early treatment is key to preventing blindness. If left untreated, glaucoma can cause complete and irreversible blindness. Blindness not only affects a person's ability to take care of themselves and their family, but it also has a huge impact on the community and the country. With glaucoma being seen in 10% of the patients that we see in Grenada, we saw many patients who will go blind if they are not examined and treated yearly. Therefore, until eye care becomes readily available in Grenada, medical missions such as ours plays an essential role in addressing the eye care needs of this developing country.
Hi, I'm Casimir Thomas, a resident of St. David. I'm here today at the Youth Center, St. George, with that team that came from parts of the United States, Jamaica, to conduct this eye clinic. And it's amazing. It's second to none. The folks are great, very, nice people. They're very loving. Because when I came the first day, and that's on Monday, there were so many persons here. And people had been just like climbing over each other and just pushing and so on. And they still had patience with us and giving us the tickets to return the next day and until Thursday. I'm here today, Thursday, and the service is great. And by the way, it's voluntary. These folks left the comfort of or wherever they live, in the world, and came to Grenada to be with us and to assist us, because, people are in need, especially those glasses. I'll tell you one thing, if you had to buy one of those pair of glasses here, it would have cost you a fortune, arm and a leg, and so Brother Roy, we thank you. And on behalf of my countrymen, Grenada, the people of Grenada, Carriacou and Pidimatnik, I want to thank you all so much. God bless you all. There is so much in store for you all, and I didn't count the amount of team players, but there are quite a few, and we want to thank you. So express to them our gratitude. Thank you very much. God bless you.
Okay, my name is Margaret Thornhill, and I was just hearing about this eye clinic from Mr. Vincent. It was on news or whatever, and I came to make a try, and it was successful. And I enjoy doing this, and it was a good gesture. Everything was okay, and it have different places you have to go to check everything, and everything was okay. So I enjoy doing this, and I want to thank him, blessings to him and everything. It was good. It was good. So next time when you come back, I hope everybody take this and put everything together.
Okay, my name's Liz, and I have the privilege of joining OJA for the Grenada first time clinic this week. So I just really, I just enjoyed being able to see patients and to do the mainly screenings, but it was just such a joy to be able to to serve as we were able to. It was a hit. We had amazing turnouts, way larger than what we could have hoped for. And I brought my family, and so it was really neat to just have them be able to, hey, Isaac, Emma, say hi. But it was really great to be able to share this experience with them. The island is beautiful, and food is amazing, and we just had a blast. So thank you so much.
My name is Rolanda McQueen. I'm the CEO of Montpure Mineral Water, an award-winning international, 3 times international winning water. When Leroy called me to be a part of his mission, he called to buy water, but when I heard what he was doing, I thought I have to be a part of that mission and donate the water instead. I was totally shocked. He said to invite my workers to come along, anybody that I knew that had eye problem. When I got there, I was totally shocked to see that the amount of people, well, desperate people that was there. It made me very, very emotional. Although I live on the island, I did not realize that the impact his mission was going to have on the lives of so many people. In fact, I was due to have my eye tested, and I felt so bad when I saw the desperate people there. I said to him, no, I can't do that because I could afford to pay for my eyes to be seen, and my workers can pay for their eyes to be seen, because there were people that was desperate. There were people I was told had been there from 3 o'clock in the morning. The following day I sent my girl with water, because I realized people would not even leave their seat to go to the bathroom because they were scared that if they come back somebody would take their space. And I just want to, I think it's something we all have to support. And I hope that Leroy will come back soon, because the amount of people that was there, I knew he could not have seen all of them, and it must have been very hard. I know he had to send some people back. It must have been very hard for them to have to say to people, there are more people that are more desperate than you. So I'm waiting for the next mission. I'm going to give it my 100%, and I want to be a part of the planning for the next trip. Thank you.
I think that the things that impressed me the most about the medical mission that Roy put together were the people of Grenada. The kindness, the politeness, just the whole variety of positive energy that comes from the folks here. And Roy was able to tap into that in a way that we as volunteers were able to experience a gift, the gift that was given to many of the patients to maybe have a small better life, be able to read a book, be able to do a variety of things that heretofore were unable to do. And to see that energy come from the patients and the appreciation that was expressed was something I'll remember the rest of my life. I mean, I've never done this before. Thank you, Roy, very much. Thank you for all the people and the doctors, the optometrists who brought so much energy. I mean, their commitment level is really, I guess that's what makes doctors, because their commitment level to their patients was just unbelievable, to get the best, excellent diagnosis and treatment for the ailments that were confronted. And so it was a wonderful time for me, and something I'll never forget.
Okay, so I'm Dr. Jonathan Ottenbacher, an optometrist out of California. This is my first time to Grenada, and it was wonderful. So the first day we kind of toured around the island a little bit, saw great views, went to a lake, had some lunch. It was a great little introduction. And then for 4 days we saw patients. I think we saw around 300 to 400 patients a day, so it was really good. A lot of people needed some glasses. There's actually a lot of glaucoma here, so some people kind of already knew they had it, other people they didn't, so it was wonderful to be able to diagnose that and let them know that we could help save their vision. And there was, some diseases and things, so a lot of different stuff we saw, but it was really great for the patients because we reassured them, we let them know what was going on with their eyes, and I think they really appreciated, just the information and the education. And then, if we could help them in some way with drops or glasses or something, that was wonderful. And the ones, we didn't have anything for now, we put them on a list so we can follow up with them in the future to make sure they get the care they need.
My name is Belma Purcell, and I'm one of the nurses who volunteered with the Optometry mission in Grenada, 2024. Just talking about my experience there, it was something that I always wanted to do. It's something that I think that people should really volunteer for. And the experience was wonderful. It was an eye-opening the first day when I saw the crowd, and it was so, we walked in there and the auditorium was just filled with people. And we managed to see over 300 people that day. My part was mainly the visual acuity, testing for that, and I was amazed to see that the very young, how many young people suffer with glaucoma in Grenada, and perhaps not even aware of it. And my next goal would be finding out exactly how can we further this in treating these young people. Because I think to do a mission is one thing, but you have to have like a follow-up plan. And I think this should be one of our goals moving forward, to get to the young especially, and find ways and means of helping them for those who would not be able to afford it or who cannot afford it. It was a learning experience, really nice, and the fact that we had foreigners who really got so involved, never been to Grenada before, and how they took this so seriously. It was non-stop. Everybody was involved. From 8, we said we were going to begin at 9 o'clock in the morning. By 8 o'clock in the morning, we were all there, and 8:30, we were ready to go. And we didn't get out of there until about sometimes 5, sometimes 5:30. But it was a well job done.
Okay, my name is Andrew Johnson. I was fortunate enough to get attended by the group which came into our island to assist. It was a very interested service. I got checked, I felt okay. And they had very good doctors, and it was a great crowd and turnout, the people that they attended to. And I just thought to myself that, I enjoyed it. I had my son look at it because he wanted a kind of something wrong with his left eye, so they looked at it. And it was fun. It was a fun feeling experience.
Yes, I'd like to say that it was a great experience for me. My name is Anita. It is Cromwell to be, to give service to the country, and it was an experience that it was great that the people who the less fortunate, they got a lot of opportunity to receive glasses. And I also like to thank the Mission 24 for giving this service, voluntary service, and also we have also given voluntary service to the nation. And I know each and every one that received that service, they will have to say thank you. Thank you for the Mission of 24.
I absolutely loved my time in Grenada serving on AOJA's first vision screening trip there in March of 2024. We were able to serve over 1,200 patients, which feels amazing. Everybody worked so hard and with so much love and compassion that you just felt so good the whole time you were there. We were able to see a lot of patients give a lot of glasses out, kids who needed glasses to see and succeed in school. And we unfortunately also caught a lot of glaucoma, advanced glaucoma. Patients may have never had access to eye care or eye services or medications before, and not until the free vision screening had they ever had their eyes checked. Many were already losing vision, going blind, so I felt very honored and privileged to be able to provide them the service and give them eye drops to help preserve their vision. Grenada itself is beautiful. The ocean, the beach, the people were so kind. And I feel like I made a whole new family and a whole new set of friends, and I can't wait to go back again.